Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, For Wives Only Seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening. Welcome to another edition of our amazing Power of Woman broadcast. I am Dr. Chucks Ugoye, and I'm very glad to host another last Thursday of the month. On Thursdays, we have the amazing Power of Woman broadcast, and then the last Thursday of the month, we have Ask Your Gynae. Ask Your Gynae is our the episode where we bring in our resident gynecologist who helps to speak to women about their bodies and help give health tips and instructions and wisdom and advice from a medical perspective, on how to take care of their body. And today is another Ask Your Gynae. And we have Dr. Audrey Bugu-Gameze. In a moment, she will be brought up. And we have an exciting episode today. Today, she is dealing with why do you need a gynae? What is the necessity of a gynecologist in the life of a woman? When do you need a gynae? At what point do you engage the ministry or the services of a gynecologist? And so that's what we are dealing with today. And so, meaning that every woman needs to hear this. You know, every woman needs to hear what she has to say and then just learn wisdom from it. All right, I'm going to call Dr. Gameze shortly, and she's going to come in, and then I will see you when she's done with the teaching. I'll see you. Do have a good time. Before I call on Dr. Gameze, let's talk about this book. This broadcast is based on this book, The Amazing Power of Woman. I wrote this book a couple of years ago, and the revelation in this book is really powerful. I want to encourage every woman out there. You need to read this book, and then you need to buy it for your friends. You need to buy it for your sisters. You need to buy it for your aunties. You need to buy it for every woman around you. The stuff in this book is what has produced a lot of the ministries that we have for women, whether it's Single Ladies Boot Camp, whether it is For Wives Only, whether it's Ask Your Gynae, whether it's the Power Woman Conference, whether it's the Power Woman Academy. It's all, this is the foundation. This is the foundation. So I want to encourage you to order. Is bit.ly/Amazing Power Woman book. That's where you go and order it. All right, we're going to bring up Dr. Gameze shortly. Dr. Gameze is a specialist obstetrician and gynecologist who has a practice here in the city of Johannesburg, where she helps women every day, ministering to them in the clinical setting. And she affords us her wisdom and her expertise, every Ask Your Gynae to share and to help women. Well, let's receive Dr. Gameze. We welcome her with her profile video, and then she will come on. I will see you after that. God bless you.
Dr. Audrey Bugu-Gameze. Dr. Audrey Bugu-Gameze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Woman broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
A very good evening to our dear listeners and viewers. Welcome again to another session of Ask Your Gynae. I am so grateful to my hosts, my pastors, Pastor Chooks and Pastor Twain, for this wonderful opportunity to share my knowledge and expertise to every woman who is listening, who is tuned on, and who's gonna be shared to this broadcast too. This evening, we're dealing with a wonderful introduction into this beautiful year. It's the month of February. We just want to know. And actually, you are my inspiration for this session for today. What is the role of a gynae in a woman's life or in the women's life? Really, do we need the gynae? What's the particulars of this office? Is it something that is pertinent or relevant into a woman's life? So today, that's what we want to look at. It's basically an empowerment tool because we are daughters. We're also raising daughters. We're going to be mother-in-laws. We're going to be raising our daughters-in-law. So we need to be well empowered into what is this office of the doctor in our lives. So I have tried to make some definitions. I know people always, they say gyno, gyno. What is a gynecologist? What is an obstetrician gynecologist? Okay, I've made it very simple. A gynae is a doctor specifically for females. So any person who is a female, girl, woman, granny, a gynae is pertinent to the life of that person. And then the second kind of a doctor is an obstetrician. So normally when we address ourselves, we say, I'm Dr. Gamedze, obstetrician gynecologist. Obstetrician is pertinent mainly to pregnancy, delivery, and the 6 weeks after a woman has delivered. So if you are doing obstetrics, you are specifically focusing onto the care of the pregnancy, care of the delivery event, and care immediately after delivery. But otherwise, as a female, the doctor who takes care of you is a gynecologist. What's the difference now between a gynae and a midwife? In the book of Genesis, we read about the midwives who were taking care of the women of Israel. They are addressed to as midwives because they were mainly at the point of delivery, so the point of giving birth. In modern day medicine, midwives are taking care of patients or of women at a level slightly lower than that of a doctor. They cannot do certain interventions. So their level of accountability is slightly below that of a obstetrician gynecologist. Then what's the difference now between an obstetrician gynecologist and my GP? Because my GP, I go to my GP when I'm bleeding, I go to my GP when I want birth control and everything. The difference there is only about scope. So the GP is allowed to practice a little bit of everything. There are some GPs who have done a specialty in obstetrics, like diploma in obstetrics. Those general practitioners can do deliveries, but their scope of accountability is slightly lower than that of a specialist, which is an obstetrician gynecologist. So in medicine, it's just about hierarchy. So there are ladies who have got very good GP, very consistent general practitioners. Do they need to see a gynae? It's usually at the discretion of the doctor to say, yes, you do need to see a gynae for this or that, but their level of accountability, should there be any oversight, it is still slightly lower than that of an obstetrician gynecologist. So the question that I want to address first is, when in my life as a woman do I need to start seeing a gynecologist? It's a very subjective question. It depends on your health. It depends on the level of awareness. It also depends on your referral system. So let me take a basic health system, like the South African health system. We've got clinics which are run mainly by nurses, where we get our primary health care. So if there is nothing that is bothersome to the life of a woman or a female visiting an ordinary clinic, that woman will never be referred to the next level. But say that same woman becomes pregnant, gets high blood pressure, and maybe gets a car accident while pregnant with a high blood pressure, that woman will be lucky to be referred to the next level, where it's going to find doctors, obstetricians, and the level of encounter differs according to the level of complexity. So in the life of a woman, the best time to start seeing a gynecologist is usually at puberty. Why am I targeting puberty? It's because that is the time when the body of a woman starts showing signs of maturing. The body of a girl, apologies for that, starts showing signs of maturing into womanhood. Usually there's a lot of conflicting events that happen in the life of a woman. So a gynecologist is able to put those into perspective, and at the same time establishing a relationship that is going to usher that young woman into early womanhood, into the reproductive age, and life after the reproductive age. And then what does a gynae or an obstetrician do now from that point onward, or in the life of the woman from the time of encounter until discharge from obstetric or gynae care? I have broken this down into the various stages of life. Let me make an example of what I encounter often. You find that a mother has delivered a baby, and it is not clear whether the baby is a girl or a boy. The baby may be received by a pediatrician, and the pediatrician discovers that there is something that is not helping in assigning gender to the child. In our modern South Africa, there's a lot of conflicting events around assignment of gender. But for the purposes of this presentation and its context, I will keep it male and female. So if the baby is having a gender that is ill-defined, they will call the gynecologist to come and identify the baby's gender with the aiding the pediatrician. And if there's surgery that needs to be performed to help that baby achieve the fullness of the expression of the gender, that is usually done by the gynecologist. Another example will be a young baby, an infant who is born maybe 3 or 4 days after delivery. Mother starts noticing a discharge and mom gets worried, will take the baby to a gynecologist. Why is my infant having a discharge? Then we put that information into perspective. So that will be the role of a gynecologist from birth up until prepubertal stage. At puberty, we are mainly involved in counseling, that is packaging that prepubertal girl or girl in puberty, packaging information. Nowadays, we've got information on the internet, we've got information from friends, we've got information from so-called uncles. Everybody has everything to say around how you should be growing as a girl. So what I do, or what most gynecologists would do, is just to package that information into bite sizes for that little girl, and also not to grow up having some disturbing thoughts around growing and transiting into womanhood. Let me make an example. If you walk around as a little girl and you are budding your breasts, it is an embarrassment in some communities. In other communities, it is pride. So you find young girls walking around with the hands on their chest because this thing is busy shooting out. They are covering it. But when you get into an office like mine, I will be able to package that appropriately as to what is the relevance into that. Some girls, they leave home because they are fighting with mom. They don't understand what is happening in their bodies hormonally. It is my job as a gynecologist to package that into a manner that mom would understand what's happening into this little girl's life, and also little girl understands about the chemical changes that are taking place in her body. And also to help mom communicate with the little girl about the expectation as she is growing up. We also talk about menstruation and sanitation. In different communities, menstruation means different things, and also it's handled in different ways. But as a gynecologist, I am able to bring contemporary or standard practice into care of a little girl around menstruation, and what are the hygienic habits that are expected overall and above what is cultural. So it helps. And just to build that rapport, that relationship, being able to talk to somebody who is clinical. We are very lucky, and I must commend our educational system that they do integrate such information into curriculum. So more than hearing what Auntie said, more than hearing what Granny said, you can hear what the teacher said. In a very much positive manner. Teachers, they stand for parents in a lot of issues. So we do appreciate the formal education they give around menstruation and the hygiene thereof. As a gynae, I also deal with the abnormalities in menstruation. Some girls experience pain, some girls experience absent menstruation, some girls experience freelancing menstruation. So all of those, as a gynecologist, I am able to assess, is it because of an illness, or it is only because of the body still trying to reset itself. So we feature in those circumstances as gynecologists. The other very unfortunate, but something that we do deal with, it's teenage pregnancy. For the purposes of this meeting, I'm not going to dwell much around teenage pregnancies, but I feel that as a gynecologist and stationed in the Christian faith, it is my duty to speak to our teenagers around the dangers of teenage pregnancy, dangers of early sex, and dangers of all these contraceptives that are floating around, which our children are exposed to. Most mothers will approach this topic with anger, approach this topic with implied statements as if the child is already practicing. Or some mothers, as I see it in my practice, they bring their daughters to say that, please put a loop in her. And you find that poor girl is not even sexually active, but mom, because of fear and because she's protecting herself, she's already starting the little girl on contraceptive. I feel that as a female gynecologist stationed in the religion of faith, stationed as a representative in the body of Christ, it is my duty to empower our girls around early teenage pregnancy, around contraception, and around the expectations of how do you handle your body as the temple of the Lord? I am not going to dwell much into the spirituality around this. Pastor normally teaches around how to handle yourself as a woman, but I feel that I am well positioned to advise our little girls around teenage pregnancy without judging them. Then moving on to women of reproductive age, what does a gynae do with women who are in the reproductive age? It's mainly around family planning. Family planning includes contraception, includes spacing. So we do talk about those things. Those who are about to get married, we meet and we discuss things that are pertinent to sexual health and life in marriage. We discuss contraception. We discuss the various options that are available, and how to take care of yourself, as in the checkups that are needed when you are in the reproductive age. Those who proceed to be pregnant, Pastor Chooks likes to say it is reserved for marriage. Yes. So those who proceed to be pregnant, we discuss the pregnancy itself. We discuss the care during pregnancy and delivery and how to take care of the baby in conjunction with the pediatrician now. Another factor that is important in the reproductive age is that we do surveillance of diseases which affect women in the reproductive age. This can be diseases related to sexual health. It could be also diseases related to a growing woman. Let me make an example. Diseases of sexual health, they can still get a syphilis, you can still get a gonorrhea. Diseases that are pertinent to a woman in the reproductive age, it could be blood pressure that solely starts in pregnancy and ends in pregnancy, diabetes that starts in pregnancy and ends in pregnancy, diabetes that can hinder you from falling pregnant, and how to gain control of certain diseases in a manner that even if you are on chronic medication, but still you've got successful pregnancies. That's the role of a gynae in conjunction with other doctors who may be like physicians. So a gynae features in preventative care, features in curative care, features in tertiary care. Let me make an example. There is a lady who gets seen by the GP presenting with persistent bleeding and inability to fall pregnant. When the GP refers that patient to the gynae discovers that actually there is high blood pressure and there are fibroids. So I will do the treatment of the fibroids, refer the patient to a physician who will do the care and treatment of the high blood pressure. And with those two doctors taking care of, pregnancy can be a possibility, and then we continue taking care of the pregnancy. So multidisciplinary approach to specialized care can be directed under the care of a gynecologist. And then after the reproductive age, which is post-reproductive, perimenopausal, and postmenopausal, a gynecologist is very crucial now in surveillance of late onset diseases. And usually these diseases can be cancerous or can be lifelong diseases. An example would be surveillance for diseases like cancer of the endometrium, cancer of the ovary, or late onset cancer of the cervix that can be surveilled in the postmenopausal life. Some ladies will develop lesions on the vulva, maybe because of poor hygiene or difficulty in hormonal balance. All those can be assisted or surveilled by a gynecologist. Bone health is very important. At the age of postmenopause, surveillance of bone health or the quality of the bone is important. This is to prevent issues like Granny was just walking, fell and fractured. Now we having difficulty taking care of Granny. So it is very, very important that we stay under the care of the gynae. One may ask, when then do I get discharged from the care of a gynae? I would say for as long as you are a woman and you are alive, you can stay under the care of a gynecologist. So is gynecological care important for every woman? I would say yes, for every female. Not only women, but every female needs to be under the care of a gynecologist. And if you are pregnant, you need to be under the care of an obstetrician. The other question that commonly comes up is it costly to be under the care of a gynecologist? My big answer is no, it is not costly. For most of my patients, I find that it is emotionally costly than financially costly. Why do I say emotionally costly? Most ladies associate a gynecological visit with undressing and body shaming. That's not the case. When I look at a woman looks like a hairstyle. It's something that we see every single day. And we appreciate who you are, whatever form, whatever shape, whatever beauty, because our sole purpose as gynecologists is to take care of the woman. Sometimes when doctors mention something, it's easier to take it as body shaming than to take it positively. So I feel that it is in the nature than in how the doctor says it, that some people are sensitive to criticism, or some people will take advice as criticism. So go with a positive mind. Go with a positive mind. So gynaes should not be emotionally costly. They should not be financially expensive. I'm gonna make an example of our health system in South Africa. In the public care, you might find that it takes a certain pyramid to eventually get to see a gynae. In private, however, it is a little bit easier to eventually see a gynecologist. So if you are under the care of a medical aid system, usually they've got some restrictions as to how many times you can see a gynecologist for which disease conditions or for which problems. Then others will say it has to be specifically under the guidance of a GP. So if you want, you can speak to your GP to say, because we've dealt with this problem for so long, may you please refer me to a gynecologist. I always call that a relationship that you have built with your GP over time, that you can be free to say, doctor, I feel that because we've worked on this situation for such a duration of time, is it okay if maybe I ask you to refer me to a gynecologist? In public, the discretion is always upon the nurses as to when you get referred to see a gynecologist. So I can say that the best time to start seeing a gynecologist, it is during puberty, and the best time to maintain a relationship with an obstetrician, it is during pregnancy. By the way, most women start having a relationship with a gynecologist during pregnancy, and that is usually a lasting relationship. So how do I select who takes care of me? Which gynae do I go to? I've left that as an open-ended answer question, mainly because even in relationships around us, it is about the gender, it is about the chemistry, it is also about how comfortable are you with the age group of your doctor. Some of us feel the older, the more experienced. Some feel a male gender is much more gentle because they don't understand what a fricadilla is happening. When I say ouch, they will take it as ouch. Others feel like, no, a female is better because a female identifies with. So it's mainly about how comfortable are you with a certain personality, with a certain gender, and with a certain age group. Anxiety is what comes up more often. I get more anxious when I go to see a gynae. How do I deal with? For me, it still boils down to get a doctor that you will be very comfortable with. And it is allowed to move from one place to the other. It is allowed to go and shop for what you think is good for you. You will never be killed from leaving a doctor because you are uncomfortable. So it is very, very important to choose a doctor that you will be comfortable with and build a lifelong relationship. I hope I've managed to answer why is the office of a gynecologist important in a woman's life. So in summary, there are people who like to say, what's the take-home point? Let me give you the take-home point. So the take-home point is, number one, if you are a female, you do need a gynae in your life. It can be gynae information, it can be gynecologist as a doctor, but you do need that kind of an office in your life. Secondly, when do you start seeing that kind of a doctor? Preferably puberty or pre-puberty, and the relationship must be lifelong. When do you get discharged? You get discharged when the Lord calls you. You get discharged from a gynecologist care. And how do I choose a doctor that I like? It is purely about intuition, word of mouth, praying about it, but it must be somebody that you are comfortable with, age-wise, gender-wise, and chemistry-wise. Those are the take-home points. May the Lord bless you as you continue enjoying our monthly sessions of Ask Your Gynae. We do have our email, which is askyourgynae@gmail.com, where you can drop any question, any concern, and any topic that you would like us to deal with on our sessions. We will gladly get back to you and we'll gladly integrate that into our session. Thank you very much for joining us this evening. Till we meet in another session, may God bless you.
Dr. Kamese, thank you so much for another very insightful session. Thank you for all that you have shared. Thank you for all that you do. Well, my dear sisters, my dear daughters, my mothers, everyone who has listened, well, make use of the wisdom that has been shared. If you have not been using the services of a qualified healthcare professional in the office of a gynae, well, you've seen why you should. I will wrap it up there for tonight, and then we will see you next week for another edition of the amazing power of woman. Until then, stay fit spiritually, stay strong in your soul, and stay healthy in your body. God bless you. Good night. Bye-bye.
Why are you still single? Do you feel you're not ready yet? Do you say it's not my time yet? Have you made mistakes in the past and now you're stuck in a complicated situation? Or perhaps you've given up totally on the idea of marriage? Why not join Pastor Chuksogoye, author of The Amazing Power of Woman book, and his wife, Pastor Toyin, the founders of the Power of Woman Academy, at the next Single Ladies Bootcamp to explore and answer your questions? A big miracle could be waiting for you. For more information, visit www.stlbc.co.za or WhatsApp 081 421 0835.